Good afternoon, I'm Bobby Out and I'm the Dare County Manager. I'm here today to talk to you about the COVID virus and some of the things that we're doing here in Dare County. When I finish in just a minute, Sheila Davies, our Health Director, will come and talk to you about some more of the precautions that you all need to be taking as citizens to prevent the spread of this pandemic here in Dare County. This morning, our control group met. We've met several days now. I've spent hours going through a number of things, a number of choices. We've talked with all of our partners at the state and local level, trying to figure out ways that we can do things to prevent the spread of this virus in Dare County. The control group decided this morning that one of the things that we could do was to limit the number of tourists that come into our county and visitors. And so effective at 2 o'clock today, the control group has limited visitors on Dare County from coming through checkpoints in Dare County, and we'll have people there to stop the visitor population from entering. Right now, our restrictions are only for visitors, the people who work in Dare County, the people who live in Dare County, and the resident property owners in Dare County will be allowed to come through the checkpoints to get to their homes and to get to work. We are using a similar process that we use when we re-enter for hurricanes. You will have to go online to get a permit if you're a worker. If you're a resident, your driver's license will work, or you can go online and get a permit as well. If you need to travel to Dare County and you're here already and you're talking about traveling tomorrow, we would ask that you please wait until later today to go online to get your permit. If everybody does it all at one time, it's going to bog the system down and be real slow. So the later you can wait before you have to come to Dare County, the better for going online and trying to get your permit. Once you have a permit or you have your driver's license or you have one of those methods to get through into Dare County, please take that and display it in your windshield. Our goal would be that it would allow the people at the checkpoints to see if you're eligible for entry and allow you through quickly. It would also eliminate their need to have contact with people coming into Dare County, and with social distancing that we need to be doing to prevent the spread of this virus. It'll help them and help keep them safe and help keep you safe as well. If you can't do that, or for whatever reason haven't do that, then you're going to have to show your credentials to the deputy at the checkpoint. And so to the extent you can put it in the window where they don't have to open the window and you don't have to open the window, that'll speed things along and make it much safer. Visitors will not be allowed through Dare County to access Hyde County or Terrell County or Corolla. People who reside in Ocracoke or who reside in Corolla, people who own property in Ocracoke or Corolla, and people who work in Ocracoke or Corolla will be allowed access through Dare County for those purposes. If you have questions, we have a phone line open. The number is 252-475-5008, 252-475-5008. We have our phone lines open. We have people on there. We can answer questions both about the entry process, and we also have nurses on that line that can answer any questions you have specific to the virus. And so with those things said, I'll turn this over to Dr. Sheila Davies, our Health Director, and she can talk to you about some of the other things you need to be doing to prevent the spread of this virus.
Hello, I'm Sheila Davies, Director of Dare County Health and Human Services. I would like to provide you with updated information on the current status of COVID-19 in Dare County. As of 1 p.m. on March 17, 2020, there were 5,068 reported cases in the United States, 39 reported cases in North Carolina, and 0 individuals have tested positive in Dare County. As case counts grow in North Carolina, it is important to remember the majority of individuals who become ill with COVID-19 will only experience mild to moderate symptoms. Call before you come is best practice for any type of services you may need, whether it's a county service or a non-emergency medical care. This can reduce the need for face-to-face interactions, as well as allow you to get the information you need prior to showing up. For example, your healthcare provider will be able to do a screening to determine what your next step should be, or the county offices can let you know if any alternatives exist in lieu of face-to-face services. Yesterday, the federal government announced guidelines and a plan to slow the spread of COVID-19. Dare County will adhere to the guidance from the CDC and North Carolina Department of Health and Human Services. All Dare County community members should adhere to the following guidelines. If you feel sick, stay at home. Do not go to work. Contact your medical provider. If your children are sick, keep them at home. Do not send them outside for activities. Contact your medical provider if someone in your household has tested positive for COVID-19. Keep the entire household at home. Do not go to work. Do not go to school or childcare. Contact your medical provider. If you are an older person, stay at home and away from other people. If you are a person with a serious underlying health condition that can put you at increased risk, please stay at home and away from other people. Even individuals who are young or otherwise healthy are at risk, and their activities can increase the risk for others. It is critical that everyone does their part to slow the spread of COVID-19. Avoid social gatherings in groups of more than 10. Avoid discretionary travel, shopping trips, and social visits. Do not visit nursing homes or retirement or long-term care facilities unless to provide critical assistance. Practice everyday preventative actions and good hygiene now. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Sneeze or cough into a tissue or in the inside of your elbow. And disinfect frequently touched surfaces as much as possible. It is recommended that individuals work from home whenever possible. Individuals who work in a critical infrastructure industry, such as healthcare services or food supply, have a special responsibility to maintain your normal work schedule. Those individuals and employers should follow CDC guidance. The additional guidance we are implementing today will help control the spread of the disease and ultimately reduce the number of sick people in our community. I understand and sympathize with the frustration and concern over the frequent guidance changes. Part of this reason is that this is a novel virus, meaning it is new, and every day we are learning more about its impact and potential for spread. I also understand and sympathize with the fears and concerns. As with anything that is new, it is common to have fear. Facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we have it. To help calm anxieties and fear, please go to reputable sources for information. We encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County Call Center at 252-475-5008. Thank you.